Bismillahirrahmanirrahim. Assalamu alaikum. My name is Dr. Roomana Rashid and I am going to teach today about thrombosis and embolism. The learning objectives of today's lecture will be we will see how to define thrombosis, embolism and infarction and what could be the possible effects of these on body and causes of venous thrombosis. Thrombus is an intravascular clot which can be formed anywhere in the vascular system, and there are many risk factors which may lead to the formation of thrombus, such as in conditions that lead to decrease or slow blood flow. They increases the risk of development of thrombus in vessels, such as when a blood vessel is compressed by an adjacent structure such as tumor, or in prolonged immobility as in bedridden patients. Due to slow blood flow, there is increased chances of thrombus formation. Or it could be formed by damage of the intimal lining of the blood vessels as in atherosclerosis or by trauma. The factors that increase blood coagulability, such as in those patients who are on oral contraceptive pills for prolonged time due to increase in estrogen, there is increased blood coagulability and increased chances of development of thrombus. And any other malignant diseases or some disorders of blood clotting which increase the blood coagulability, they increases the risk of thrombus formation. Embolus is a fragment of thrombus, or it would be a mass of any material that is carried in the bloodstream. When emboli lodge in any blood vessel, they partly or completely block the blood supply to the distal tissues. Emboli, which originate in veins, travel towards the heart, and from there they travel to the lungs in the pulmonary artery, and they may lead to the pulmonary embolism. On the other hand, the emboli which originate in artery, they travel away from the heart until they lodge or block any vessel or any artery that is supplying to any tissue and result in damage or death of that tissue. Infarction is tissue death due to interrupted blood supply. The consequences of interrupting tissue blood supply, it depends on the size of artery blocked and the function of tissues affected. Ischemia is tissue damage because of reduced blood supply. Embolism occurs when an embolus obstructs a blood vessel, and the consequences depends on the artery involved. If a coronary artery is blocked, that may lead to myocardial infarction, such as if cerebral artery is blocked, that may lead to cerebral infarction. It depends on the artery which is blocked. As we see in this figure, in A there is partial blockage but normal perfusion. Here the blockage is not that much and the tissue is getting enough blood for normal functioning. In B and C, there is complete blockage that causes tissue damage due to ischemia and infarction, and it depends on the location of the blockage. Atheromatous plaques are patchy changes that develop in the tunica intima of large and medium-sized arteries. The initial changes, they only consist of fatty changes in the arterial wall. But in mature plaques, there is accumulation of cholesterol and lipid compounds, and there is excess smooth muscles with foam cells. Foam cells are fat-filled monocytes. Usually the mature plaques, they are covered with a fibrous cap. A plaque grows and spread along the artery wall, and that may obstruct the lumen. The plaques may rupture, and when they rupture, they used to expose the subintimal materials to the blood, which causes thrombosis and vasospasm, and they compromise the blood supply. As in this figure, you can see there are different linings of blood vessels. The innermost lining is tunica intima, then there is subintimal layer, and there is a muscular layer that is called tunica media, and the outermost layer is tunica adventitia. In B, you can see here the fatty streak, that is the initial plaque formation, and when the mature plaque is formed, you can see here there is accumulation of smooth muscles with this fatty deposits of cholesterol and other lipids. And in picture D, you can see here a ruptured plaque with thrombus formation. What could be the complications that can occur with atheroma? These are thrombosis and infarction, hemorrhage, and aneurysm. Atherosclerosis. Atherosclerosis is a disease that is characterized by presence of plaques are called atheromas, and there are various predisposing factors in atherosclerosis, such as if a patient has family history, he has more chances of development of atherosclerosis. Obesity and gender, if this is more prevalent, atherosclerosis is more prevalent in males as compared to females until the females they reach the age of menopause. And if someone takes more refined carbohydrates or diet that is consists of more saturated fats and cholesterol, that increases the risk of atherosclerosis. Age, with increased age, due to the vessels they become rigid and they become more susceptible to atherosclerosis. Smoking, diabetes increases the risk of atherosclerosis. Any kind of emotional stress, hypertension, sedentary lifestyle, and excessive alcohol consumption or hyperlipidemia, these are the factors which increases the risk of atherosclerosis. But they could be modifiable factors. If we can control these, or we can change our lifestyle, we can adjust, we can help to modify the outcome of the disease. What could be the effect of atheromas? Atheromatous plaques may cause partial or complete obstruction of an artery. The blockage may be complicated by clot formation, and the consequences depends on the site and size of the artery involved and the extent of collateral circulation. Commonly, the arteries which are affected, they are in heart, abdomen and pelvis. In atherosclerosis, large and medium-sized arteries, they get infiltrated with fibrous tissue and calcium, and as a result the vessels, they become dilated and they become inelastic and tortuous. Due to this loss of elasticity, there is increased chances of increased systolic blood pressure and increase in pulse pressure. On the other side, when small arteries are involved, their lumen is reduced due to deposition, and which could reduce the elasticity of the vessel wall, and they lead to increase in peripheral resistance and increase in blood pressure. In limbs, this can atherosclerosis that can predisposes to ischemia and ultimately gangrene, and this condition is more present with the advancement of the age, or with the increase in age due to decreased elasticity and decrease in lumen size. There is more chances of atherosclerosis. Venous thrombosis. Thrombus formation in veins is called venous thrombosis. It could be superficial or deep. In superficial form, the thrombosis occurs in superficial veins, and the condition that occurs is called superficial thrombophlebitis. In this condition, the tissues around the affected vein, it becomes red and painful, and mostly the common causes are intravenous infusion or varicosities in the saphenous vein. Deep vein thrombosis. If a thrombus is formed in deep vein, that is most commonly in the lower limb, then it is called the deep vein thrombosis. Deep vein thrombosis is usually accompanied by pain and swelling, but is often asymptomatic. The common complication of deep vein thrombosis is pulmonary embolism. Thank you.